Hi, I'm Julie Payne, licensed marriage and family therapist, doctoral candidate at North Central University, and the founder and executive director of Thrive in Schools. The idea of Thrive came about in 2017 in the aftermath of Hurricane Harvey. I had a small practice in Houston area, and so many of my clients, my friends, my colleagues were dealing with the impact that Harvey caused. I saw then the need for additional support in our school setting to help our students and families cope with the aftermath of the hurricane. Because I was living in Southern California, however, it was difficult to get it launched out there while living here. And so I decided to look at the beach cities and see what support existed here. And I found that there was still a gap here. And so over the last couple of years, I piloted Thrive at a small private school and have seen the impact and the success that it's had, and realized that with the pandemic, this is really the opportunity to reach a greater level of students and their families and provide that much needed support that we all need right now. Thrive aims to fill the gap of mental health services currently available at schools by providing an additional layer of support for students in need. The U.S. Surgeon General, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and Children's Hospital Association, in addition with the National Association of School Psychologists, have all issued a state of emergency for youth mental health, and some have even compared the state of mental health as the parallel pandemic alongside with COVID. Prior to the pandemic, California had a gap in mental health services that were available at the schools, which has only increased due to the global pandemic of COVID-19. In a study looking at treatment rates for depression across the country, California ranked 45th in the nation when it came to treating youth with depression. That equates to 66% of youth that did not receive services when they were diagnosed with depression. And of those students who did receive services, less than 25% reported receiving services on a consistent basis. There are several challenges when we look at mental health services in our schools. And several of those challenges include lack of funding or various funding streams, lack of collaboration and coordination with additional providers, administrative and billing costs, diagnosis criteria, treatment modalities, including treatment length. As the state is concerned, they know that there is a need, yet they continue to focus on at-risk youth. And for the state level, at-risk youth are typically students in low socioeconomic areas and are either in the foster care or adopt system or on Medi-Cal. And that leaves the rest of the population looking for services and funding through other avenues other than what the state provides. So when we look at the beach cities, we are in a fairly affluent area with a middle to high socioeconomic status, and less than 5% of the population within the beach cities fall below that federal poverty line. That leaves 95% of students underserved from state-sanctioned mental health services. And if any of those students in that 95% have a mental health concern and need services and cannot receive services at their school currently, they need to find a therapist within their community, which creates additional barriers of leaving school, time off work, collaboration, and efforts with the school. There are several factors that impact a youth's mental health, including individual, family, community, the environment, and society in general. And COVID has really had an impact on each one of those levels. The U.S. Surgeon General just issued a public health announcement addressing the needs to provide a continuum of supports to meet the student mental health needs, including evidence-based prevention practices and trauma-informed mental health care. When we look across the nation at youth mental health, we see that 1 in 5 children have a diagnosable mental illness that are between the ages of 13 and 18. And given classroom size, that roughly equates to about 4 to 6 students for each class that are experiencing a mental illness. And 80% of children never receive proper treatment for mental health services. And suicide has been shown to be the third leading cause of death in people between ages of 10 and 24 years old. All of these statistics were prior to the pandemic, and we're expecting to see an increase as new data continues to come out due to COVID-19. Looking at the statistics for the South Bay youth mental health, the numbers are shocking. 40% of 7th graders reported bullying, while 42% of 11th graders and 29% of 9th graders reported using alcohol. 16% of 11th graders reported seriously considering or attempting suicide, and suicide has been shown to be the second leading cause of death in people 10 to 34-year-olds throughout the state of California. Again, all of these numbers were prior to the global COVID-19 pandemic. And again, we're expecting to see these increase as new statistics and data are released. There are several implications for mental health that can affect the youth throughout their life, including that mental illness has been linked to a decline in grades and school performance. It also increases the likelihood of substance abuse, it increases risky sexual behaviors, and it also increases the likelihood of involvement in the juvenile justice system. Here we have levels of support that are available for youth for mental health services. At the bottom, we have school-based services, community mental health, intensive outpatient, and inpatient. Thrive bridges that gap or fills that gap between school-based services and community mental health services by bringing those quality private practice therapy services from the community directly to students who need it at their school. Taking a closer look at the bottom tier from the last slide, this is the continuum of school-based mental health services, and this is put out by the National Association of School Psychologists. There are 3 tiers of levels of support within the school system. The tier 1, or the bottom tier, which is available to all students, and this includes social emotional learning and brief interventions. Tier 2 is for targeted at-risk youth that may have been identified as needing a little bit more support than Tier 1 offers. And Tier 3 is for students with severe, chronic, ongoing mental health concerns or issues, and they need additional support like ongoing therapy and different school interventions. At the very top is where Thrive fills that gap, and normally where students would be referred out to the community to find a therapist. Thrive is able to come in and work with those students directly at their school campus. This slide gives a little more detailed look at that tier system. Here we see where all students receive that Tier 1 services of social emotional learning and brief interventions, up to Tier 2 where it's more targeted interventions, but it's fairly brief. And then top tier, Tier 3, is traditionally just a few students compared to the student body. But due to the implications of COVID-19, more students are falling into that top tier than ever before. And that's where Thrive comes in to provide those additional services that the students can't access at their current school. And instead of going into the community and taking time out of their school day, Thrive is able to come in and work with those students and their families directly at their school site. Looking at that top tier, Tier 3, students who have met the criteria of Tier 3 have typically been identified by current mental health programs. And if they're not receiving services, they're referred out to additional programs within the community for the following reasons. So referrals can occur if the student is experiencing trauma or PTSD, severe depression or anxiety, any moderate, severe suicidal ideation, additional family involvement, and really any other severe level of mental health issues or problem behaviors that are chronic, frequent, dangerous, highly disruptive, impeding learning, and or resulting in a social or educational exclusion. The California Department of Education and the U.S. Surgeon General have issued statements addressing the growing need for school-based mental health services and have really highlighted the need for collaborative efforts between the education system and the mental health care system. In a recent statement issued by the Surgeon General, he addresses that as we learn the lessons of COVID-19 pandemic and start recovering and rebuilding, we have an opportunity to offer a more comprehensive, more fulfilling, and more inclusive vision of what constitutes public health. And for a generation of children facing unprecedented pressures and stresses day in and day out, change can't come soon enough. Thrive aims to fill the gap in services by bringing quality private practice mental health services directly to students and their families at their school setting. Thrive provides an additional layer of support to services already in the schools. And Thrive therapists provide a trauma-informed collaborative approach to work with those students who need services but don't meet the criteria for the programs currently available in their school. Thrive operates from a three systems approach. From a systems perspective, we work with the individual, the teacher, and the families. From a strength-based self-awareness, develop healthy coping skills, and tools and interventions that the student, the teachers, and families can use and incorporate throughout their lives. Our Thrive team looks forward to serving the South Bay community and improving the mental health and lives of our students and families.